Alright, hey guys, my name is Janice.
Hi, Sophia.
And we've developed this great new studying tool. The name of our game is Pronto PT. So pretty much it's a game to help students study before an exam. Ideally, we have a stack of cards. These are index cards that have been created for whatever test the student is studying. So ideally, the students have studied these cards before they play it. And then the goal of the game is to help learn, memorize, and quiz each other while you're playing the game. So the premise is that you have two stacks of cards. This stack is a stack of drugs that we're studying for that section. This stack is a stack of disease states. So what happens is the student is going to, each player gets 5 cards. As you utilize those cards during the game, you'll be dealt a new 5 cards. The game is over once you are done with the drug stack. You also have a stack of disease state cards. So once you begin the game, someone is going to flip over a disease state card. Let's say this one says depression. Now, anyone who has the cards can put down a card. And the idea is that you're supposed to put a card that relates to that disease state. So for depression, and you guys will see this as we actually play the game, but for depression, let's say someone puts down this card, which is TCAs. And I put it down before Sophia does. There's kind of like a race there. Whoever puts it down first automatically gets a point. But your opponent has a chance to steal. They have 1 minute. If you put down the card first, they have 1 minute to steal if they can say a couple points about that card, things that are on the other side. And we'll show you guys as we play the game. So let's say that Sophia says a couple points about that card. She can steal my points, and then we'll flip the card and go over important things that are on here, so you're utilizing it as a study tool. And you guys will get a little bit more of a feel for it when we actually play the game, which we are going to start, I guess, now.
And also, the disease states, of course, it's limited to a certain amount of disease states that you cover per, let's say, exam. So the disease states will keep rotating, and what happens is, once that disease state comes back around, then we have to say 3 new facts about it and not repeat the facts as well. So at least it keeps it going, and if you miss certain important key things about a specific disease state or drug, it still gives you the opportunity to touch back on those important things that we miss out as we go on and move on with other cards and other drugs.
Exactly. So we don't have the best way to film this, so we might have to explain what some of the cards say as we go. But we'll try and show you guys because the camera is kind of limited. So we're going to go ahead and start, and I'm going to flip the first disease state card. It's depression. Wow. Okay, so Sophia beat me.
I sort of cheated because I knew she was talking, so I had an advantage over you. So. Okay,
so Sophia put down the card vilazodone. So she put it down before me. She gets a point. Now I have to be able to say a couple points. So vilazodone, brand name, Vibrid, and I think that one has strong CYP3A4 interactions. Okay, so let's see if I actually am going to be able to steal these points. So we flip the card. And we're going to go over some of the things that are on here. So, Sophia, you want to...
So, if you look at the card, I'm not sure how well you can see it, but pretty much you have everything you need to know possibly on the card as far as indications, contraindications, drug interactions, any adverse reactions as well. So I can kind of match what she tells me in case maybe I'm not familiar with it as far as the points that she brings up, and then also... we can touch base on other important things like the contraindications with the MAOIs, as well as the adverse reactions, the most common ones, which are the diarrhea, the nausea, the vomiting, and things like that.
So ideally, even while you're playing and you're getting points, you're utilizing these cards to study everything else about the drug. Like, let's say I just remember 2 points about it. Well, then we're able to tell each other, okay, yeah, but don't forget that, there's a black box warning for suicidality. Or that it comes in 10, 20, 40 milligram strengths.
And the good thing also about that is that as we continue with the disease state, depression will come back up again. And, keep in mind you have to come up with something different than just, for example, in this situation, she came up with a brand name and how drug interactions with the CYPs. So when the drug comes back around, because we kind of went over other information, it's going to help her when that disease state comes back up to come up with another fact or 2 about it in order to steal my points.
Exactly, or use a different drug that can be used for the same disease state. So now we're going to go for the next card. All right, so this one is PTSD. Oh, what do I have? Okay, I beat you.
Yes, you did.
Okay, so I just threw down a card for SSRIs.
So for the SSRIs, I believe the drug of choice or kind of first line is sertraline,
Okay.
which is Zoloft, and you can also use fluoxetine Prozac as well for the treatment of PTSD.
Okay, so let's check it out. So, yes, perfect. So we have a list of SSRIs. She listed 2 that are on here, and sertraline is first line. So she gets to steal that point. And then when it comes back around, we'll be able to say something else about the drug. So she gets that card. And the way you're going to be able to add the points up is depending on how many cards you have. Each card you get, or that you steal, is 2 points. All right? Schizophrenia is the next card. Damn it. Okay. Clozapine. Okay, clozapine, black box warning for agranulocytosis, and it's a second-generation antipsychotic.
Correct. Yes. And then Clozaril is a brand name. Remember, you have to stop the therapy gradually, so you have to do it in over like 1 to 2 periods on there.
Okay, cool. All right, let's see. Generalized anxiety. Gosh. What? No. Oh, we both put a benzo. Okay, she beat me. She put it down first. Okay, benzodiazepines. Okay, so you can use benzos for, yeah, my dogs are in the background barking, so that's kind of funny. Okay, you can use benzos adjunctively or by itself for generalized anxiety. Some list of names of some would be your Xanax. A short-acting benzo would probably be better depending on the kind of anxiety the person is having.
And that is correct. And then on here, again, on the card, we actually have other benzos that can be used and brand generic names and things like that.
Okay, so this has been a general overview of our game. Don't mind my dogs in the background. If you have any questions, let us know, guys. But I think this is going to be a real hit.
Thank you.